Hello, I'm Krystyna Makowiecka and I'm a member of the DHIS team working in Gombe State in northeast Nigeria. We're collaborating with the State Primary Healthcare Development Agency to track maternal and newborn health indicators. Part of our team is Antoinette Bhattacharya, who's been working on DHIS2 and has recently published a paper on her work. Antoinette, tell me, why is this paper important?
I think what we know is that there's an overall and there is a local importance for this paper. Overall, we know that when countries are their own routine data is of high quality, that they can use it and they can trust it to know whether or not mothers and babies are accessing the services that they need. Then there's also DHIS2, which is the District Health Information System, which is an open source information system that's being used across 60 countries and increasingly so. And countries and global initiatives are looking at it to support the monitoring of health programs. And there was a local importance. Our DHIS project had been working with Gombe State, where maternal neonatal mortality is quite high. And the Gombe State Primary Healthcare Development Agency had a really strong interest in using their own data for monitoring.
So tell me what you did in Gombe State.
So we wanted to use Gombe State as a case study for understanding what is the quality of routine data within DHIS2 to monitor maternal and newborn health priority indicators. So first we had to figure out what were those priority indicators, and we studied the strategies for ending preventable maternal mortality and the Every Newborn Action Plan to understand what were those priority indicators that we wanted to monitor. Then we mapped those indicators to the facilities and to see what they were documenting and then what they were reporting. And then we looked at those indicators within Gombe's DHIS2 to understand the routine data quality. And we looked at three particular overarching data quality dimensions: its completeness and timeliness, its internal consistency within its own routine health information system to the degree to which it sort of agrees with each other, and then how much it agrees with external resources by looking at external consistency.
And what did you find?
What we found was that for the 12 of the 14 priority indicators that we did assess, that 12 of them are already being reported within the health information system, which tells us that they're doing a lot of work already to make sure that they're collecting the right data. When we paused to sort of look at what the quality of those indicators were like, we found what you would normally expect, that yes, there is a lot of incompleteness and that there is internal inconsistencies as well as external inconsistencies. But what we did find, which was interesting, was that they weren't universally poor and that the data quality wasn't equally poor.
And how can countries maximize the benefit of DHIS2?
So I think what our study found is that coordinated action at all levels of the health system is needed to ensure that the routine data is of high quality. A commitment to using DHIS2 should really also include an investment in its ongoing maintenance in terms of reviewing its content and its structure for fitness for purpose. First, it's really important to strengthen what is already there to make sure that we're rationalizing the data and ensuring the completeness of the existing data. Studies have shown us that even for efforts that involve a technology-based solution like DHIS2, nothing substitutes just feedback and supervision where we come together to make sense of the data.
Thank you, Antoinette. From what you've told us, it sounds really important to work on the quality of routine data. If you'd like to read the paper, it can be found on our web pages at the link below. Thank you.